Hello, today I'm going to be talking about ways we as teachers can help our learners who might be in need. We've all heard these terms tossed around: the struggling resident, the problem resident, the resident who's drowning. But all of these terms put the onus and even the blame on the learner, and they don't actually get to the underlying issue. Why is the learner struggling or drowning or simply in need of a bit more from us as teachers? So I have a few key points that I want you to take away from this short talk today. I want you to be able to recognize the importance of diagnosing the specific issues for those learners who might be in need. I want you to identify ways you can, as a teacher and mentor, make your feedback more specific. And I want you to be able to use the core competencies, sub-competencies, and milestones to frame and document your feedback, evaluation, and assessment. When first looking to diagnose the learner, keep your differential diagnosis broad. Is it clinical reasoning, medical knowledge, communication skills, presentation skills, data collection, data synthesis, response to feedback, confidence, organizational skills, physical examination skills, their ability to prioritize, etc.? What exactly are the issues at hand? And then don't forget about other things that might be going on, such as depression, burnout, anxiety, other mental health disorders, and learning challenges and differences that might not have been diagnosed yet. And when thinking about your learner's ability to care for patients in a graduated fashion, think about where they are in the RHYME model. I find this model very helpful. Are they a reporter who can accurately gather information and report it out to you, basically an early third-year medical student? Are they an interpreter who can understand the clinical significance of the information and generate a differential diagnosis, basically a fourth-year med student or an early intern? Or are they able to manage patients, creating a diagnostic plan and therapeutic plan, basically an end-of-year intern or a second or third-year resident? Or are they educators, our chief residents, our fellows? Can they not only manage patients, but teach others how to do so as well? And for residents and fellows, it's helpful to think about where they are within the different sub-competencies and milestones, specific things that they're supposed to be able to do at different stages within the 6 core competencies of patient care, medical knowledge, systems-based practice, practice-based learning and improvement, professionalism, and communication skills. These slides that are included have the specific sub-competencies and milestones for internal medicine residents. The sub-competencies are the categories such as history taking and physical examination within patient care that you see here. And the milestones are along the horizontal axis and really identify the specific behaviors at each level. I've included the entire set here for future reference, continuing with patient care, medical knowledge, systems-based practice, practice-based learning and improvement, professionalism, and communication skills. So putting it all together, you can identify the specific issues and the areas that are difficult for your learner. You can then try to understand where they fit in the RHYME model in the care of most patients. From there, you can identify specific sub-competencies and where they are in the milestones and how to outline their strengths and areas in which they need to improve. Think about the transition that trainees also need to make as they move from requiring constant direct supervision to needing less supervision and even indirect supervision, and eventually being ready for independent practice. Let's quickly go through some cases to review. I encourage you each to spend more time with these cases either on your own or more preferably in small groups. Case 1. One of your interns on the inpatient service in May seems behind the other interns. He comes across as scattered and his presentations often have no plan. When asked clarifying questions, he often doesn't know the answers that the other interns and even the medical students know. His notes are often done late, they lack a clear understanding of the primary medical issues, and they're often incomplete and even unorganized. So let's work on making the diagnosis. Look through some of these specific areas that we talked about in the beginning of this talk. Map it out with the sub-competencies and milestones. Go through patient care. How's he doing in these areas? Think about where he is with clinical reasoning and his overall ability to manage patients in the inpatient setting. And how's he doing with communication skills, including presentations and even documentation? So putting it all together, at this point, he's still operating as a very early reporter. You actually would have hoped he would have come to attention before now. He is at a level 1 to 2 for patient care, and he's not really ready to progress to being able to more independently care for patients as an interpreter, much less a manager, as one would expect of a more senior resident who is allowed more autonomy and indirect supervision in their work. This would be a case in which documenting the specific behaviors and outlining the level of performance in the language of the milestones reached within each competency and subcompetency, it would be crucially needed. Let's move to the second case. A PGY2 resident is noted to be on more than one occasion not attending any clinical activities that are elective. She's behind in her in-basket. She doesn't respond to messages in a timely fashion from her patients or colleagues. Last week, she was an alternate for backup call, and the chief resident had difficulty locating her for 6 hours. As an intern, she was always behind in completing notes and other administrative duties. She was the last to get her flu shot. Her peer evaluations notes that she signs out often early, and she leaves multiple tasks for the night resident to do. When the chief resident met with her, she was incredibly defensive and started naming all of the other residents who had done similar things. So let's break this case down a little bit. This resident is having problems with professionalism and also problems with safe handoff and patient transition. So think about systems-based patient care as well. The resident's not responsive to feedback. So think about practice-based learning and improvement and where she is in the milestones through these subcompetencies. She's also having difficulty with professionalism, accountability, conscientiousness. She's not consistently performing administrative tasks and patient care activities that are needed. So breaking down this case, the primary areas of deficiency are within the competencies of professionalism and practice-based learning and improvement. And also remember to think about the impact that stress, depression, burnout, and anxiety may have. Sometimes these issues are manifest as or worsen unprofessional behavior. And the last case to review before we wrap up. A senior resident's leading a new team. The attending notes that he's incredibly efficient, very hardworking. He has extensive medical knowledge. He creates broad differential diagnoses. His notes are well organized, but he's quiet. And when the interns are off, he has a very difficult time talking with patients and families. He often uses medical jargon. He has difficulty making eye contact, and he doesn't seem to pick up on social cues from others in the room. He asks for feedback. He's very interested in how he can improve. So let's put all this together and break it down a little bit. He's doing very well with practice-based learning and improvement. He's actively seeking feedback and he wants to be better. But he's still struggling with communication skills. So find where he is in the milestones and try to use some of the specific language to help you with this case. So let's put it all together for him. Strengths, again, practice-based learning and improvement. He's actively seeking out ways to improve. But he still needs to improve upon specific communication skills. It might be worthwhile exploring whether or not he has an underlying learning difference as well. So finally, a few take-home points. How can we as teachers help our learners who need a little bit more from us? First of all, it's incredibly important. Diagnose your learner. Use specific behaviors to create your differential. Use the RHIME model for an overall assessment of their clinical abilities. Use the subcompetencies and milestones as a framework. Know when your trainees are expected to gain autonomy and move from requiring direct supervision to indirect supervision to being ready for independent practice. Think about learning differences that may not be diagnosed until people are in their adult years. And don't forget about underlying burnout, depression, anxiety, life stressors, and other mental health issues that may be impacting their overall performance. Thank you so much for listening to this talk.